So now he wants
Good afternoon, Cary Rotary Club. Very happy Tuesday to you. And most especially, a very happy birthday to our one of our founding members, Jerry Miller.
Happy birthday, dear Jerry. Happy birthday to you.
Great to have you here. We've got cake. It'll be served throughout the meeting. There's an old saying in the stock brokerage business, don't fight the tape. I know we're not supposed to be singing, but that was definitely an occasion worthwhile. All right, so thank you. Can I ask Rod Brooks to lead us in the prayer and pledge?
I will. Thank you, President Bob. Well, last week, the world lost a great peacemaker and religious teacher and leader, Thich Nhat Hanh. In his honor, I'd like to offer this as our invocation. Let us pray. These are the 5 contemplations by Thich Nhat Hanh, which are said before meals. The practice of reciting these contemplations before eating is a way to foster mindful eating and helps to promote inner peace through food. First, this food is a gift from the earth, the sky, the universe, numerous living beings, and much hard work. Second, may we eat with mindfulness and gratitude so as to be worthy to receive it. 3, may we transform our unwholesome mental formations, especially our greed, and learn to eat with moderation. 4, may we keep our compassion alive by eating in such a way that we reduce the suffering of all beings, preserve our planet, and reverse the process of global warming. 5, we accept this food so we can nurture our brotherhood and sisterhood, strengthen our community, and nourish our ideal of serving all beings. In the Lord's name we pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
All right. We also have a couple of guests and visitors with us today. So I do want to recognize Kim Riley, who's joining us again today. Kim's mired in the bureaucratic process of becoming a member of our club. So I thank you for your patience, and we're thrilled to have you with us, Kim. We'll look forward to introducing you as a member shortly. Howard Manning also has a guest. Howard.
Thank you, President. Yes, I do have a guest today. I have with me Mr. Andy Furrow. Andy is the board president of Kudos Ministries. And if you'd like to have a few words to say now.
Thank you for having me. Glad to be here. Look forward to being a member.
All right, thank you. Welcome, Andy. All right, welcome, Andy. We're thrilled to have you with us today. And thank you, Howard, for bringing him.
Neil has a guest as well.
Thank you, Kim.
Yes.
Kristen?
I'd like to introduce Dr. John Stokel. And John says he doesn't necessarily need to talk. John is a software engineer with Store.
Welcome, John. Thanks for being with us.
He has a guest. There you are. Would you like to introduce your guest? Oh, good. Oh, yes, I see your face. We see you here every time. Yes, thank you.
Thank you, Kristen. Appreciate that. Some quick items. We've got a full program today, so some quick items on club business. Rod, with a chili dinner wrap up, I think. Victory lap, is that what we're going to call it?
Okay. We had a marvelous event last Tuesday. It was really fantastic. This was our 19th annual chili dinner fundraiser. For our guest joining us today, this club for nearly 2 decades has had a commitment to ending hunger around the world and in our community. And as of last week, we have now raised more than $544,000 towards that effort. So that is just share some results here and express my thanks to everyone in the club for making this event such a success this year. First of all, tremendous outpouring of club and community support. We had 86 sponsors at various levels. Of those 86, 53 were club members. In other words, 53 of our club members were sponsors. We had an additional 28 club members who were issued raffle tickets to sell. So tremendous club outpouring of support there. In addition to club members, 33 community businesses were sponsors, plus we had 7 community businesses donate raffle items. So again, great support from our Cary community. Fundraising results. For this year's event, we raised $36,050 in total sponsorships, ticket sales, and donations, which was about $500 more than last year. Our expenses, of course, were less than half of what we normally spend when we're actually buying food and serving chili, which we didn't do this year. But they were a little bit higher than last year due to the additional raffle ticket cost and some cost of mailing and that sort of thing. So our net proceeds were $34,229. And that's compared to last year, that's consistent with last year, about 2% less than last year, but again, a great success. And I'll mention that these are, of course, preliminary results because the website is still up for donations. And we have a few more raffle items to auction off and raffle off. So look for some more about that next week. In terms of how the proceeds will be used, 60% of the funds will be used for international hunger relief, and we're going to be scheduling our Rise Against Hunger meal packaging event soon. So look forward to participating in that. 40% will be used for domestic hunger relief. All of our donors have received thank you letters, and they will be recognized in a special ad that will be published in the next edition of Cary magazine. So again, extending our thanks to everyone. I want to thank President Bob Griffin, who did an outstanding job as MC of last week's event. I want to thank Paul Wassilkavich, our club secretary, who has supported us throughout this. And I want to extend a special thanks to everyone who served on the chili dinner committee. And I'll ask you to stand as I call your name. Don Finkbeiner, who may be online with us. Don is standing at home. Scott Gardner, who couldn't be here today, but he's also standing at home. Mary Cam, who's probably online. Jim Lovejoy. Jim, would you stand? Eric Schmidt, again online. Scott Schneider. Scott, would you stand, please? Ron Stanton and Ken Tyma. Really, folks worked hard for months and months. Thanks, everybody. Great event, and thanks for all your support. Thank you.
Thank you, Rod, and congratulations to the Chili Committee for a fantastic event. I'd like to call now on Reggie Scales to share some information about staffing in the Cary Rotary Foundation.
Yes, thank you, President Bob. The timing of this could not be better. Rod just talked to you about some of the things that happen in and around the chili dinner. And one of the ways that those monies are distributed is through the Cary Rotary Club Foundation Board. And so a couple quick things in reference to the board. I am the chair or president of the board, and the members, your current members, Jim Lovejoy, who's our treasurer, Gail Cabrera, Pat Hudson, Scott Schneider, Howard Manning, who's our secretary, and our most recent member, Bruce Howell. And what we're doing really is trying to make sure that we are connected with kind of the current tenor, the needs of the local and certainly the regional society. And one of the big things we do is hunger relief. So I want to make sure everybody knows we've got right now around $13,000 of uncommitted funds for hunger relief. And the board is actually reaching out to various entities to figure out, what their needs are. Please connect with me or any of the board members that I've just mentioned if you have some thoughts or ideas of those who have needs. The second part of it is the fun things that we get to do, which is engage folks in our boards and committees. The Cary Rotary Club Foundation Board currently has 8 members, and I'm placing before you a 9th member for consideration at this point. Our bylaws are clear. Anybody can nominate a member to the board, then the foundation board has to vote on it, which happened on the 24th, and now a name is being placed before the club. That individual is Neil Lagarde. Neil is in 4 days, he'll be a 20-year member of this club, of our club. He's been around for a while. He's a past president, and the thing that he's excited about it. And when I talked to Neil about it, one of the key things he said is, this is a great opportunity for me to quote unquote re-engage and get involved in some things, particularly after what's happened over the last 2 years. And so if you got any questions or comments, please reach out to me or any other members of the board. By bylaws, it's placed before you today, and then the club will vote on Neil as soon as next week. Unless anybody has concerns or issues, it'll be on the agenda for approval. So thank you, President Bob.
Thank you, Past President Reggie. And thank you, Neil, for standing up. We'll look forward to an acclamation vote next week. It'd be great to have you on that board. Thank you. Without further ado then, well, there is more ado, one more ado. May I ask Bill Zidek to interrupt his lunch and join me at the podium? We're thrilled to have you back in person with us, Bill. I know that you have been a consistent attendee online. One of the things that happened while you were online is that Marie Howard came and recognized you and Mariel as major donors to the Rotary Foundation. So I wanted to very proudly present you the award as well as pins for you and Mariel in recognition of your generosity and commitment to Rotary.
It's an organization which you could not contribute more to in both in time and energy because of all the things that Rotary has done. I've been with it quite a few years, and I've enjoyed every minute, especially the early years, and now with this wonderful club. So thank you very much.
Thank you, Bill. Thank you, Bill. We're so fortunate to have you as a member, and just a testament to long-term commitment to the organization. Major donor is a $10,000 cumulative level of giving to the foundation, so it's rarefied in. Proud to have you with us. With that, can I ask David Coulter to please come and introduce our speaker for today?
Thank you, President Bob. So I'm pleased to introduce Robert Luisana to you today. Rob and his grandson John are with us. He is a graduate of East Carolina University in 1973, where he was the student body president, the former Guilford County teacher and basketball coach, as well as serving as president of the North Carolina Association for Educators for Guilford County. He's also a member of the Greensboro Rotary Club. And he has worked as an health insurance broker and consultant for the past 35 years, working with corporations and individuals on all aspects of healthcare and insurance. And over the past 5 years, he has been a frequent presenter on healthcare issues, including National Public Radio, Politico. He spoke last April with the Apex Rotary Club. And among his activities, he is captain of the Guilford County Senior Games basketball team known as Dead Men Dribbling. Please welcome Tom.
My hearing has gotten pretty bad. Can everybody hear me okay?
Yes.
Well, a couple of quick things. I'm trying to clear my throat. It's a privilege to get in front of a Rotary group. I'm a member of the Greensboro Rotary, and I know that Rotarians are among the most driven and respected people in the community. So I'm saying it's a privilege to get in front of you and talk. I do have slides, and John, we're going to need to get you over there. My grandson and I are doing this for the first time, so we'll see how we coordinate. I am going to talk about healthcare, and I've got slides, but it's more important to me to hear what you think. And I'm going to stop at different points and give you an opportunity to ask questions and to make comments. I was on Zoom for about a year, and I didn't really love Zoom, but the virtual Zoom was it kind of protected me from people throwing bricks and tomatoes. So I'm in person today. We'll see how it goes. I'll start by telling you a quick story. About 2 years ago, before COVID hit, I called my oldest son, who lives now in Wendell, John's father, and found out that his brother, who was then 8 years old, Mason, my grandson, had the regular flu and felt terrible. So as a grandfather, of course, I said, Brian, put Mason on the phone, let me cheer him up. So Mason gets on the phone and I say, Mason, just hang in 2 or 3 days, you're gonna start to feel better. And he doesn't respond, he doesn't say anything. 5 or 10 seconds go by. And then in a very sarcastic voice, he says, is this your idea of good news? That's my attempt at humor. I'm telling you that because I thought it's funny, but it's also a good entree in talking about healthcare, because whenever someone starts talking about healthcare, I think the first thing people in the audience think is this your idea of good news? But anyway, we do have issues with healthcare. And they range from cost, they range from access, drug prices, and I'm going to talk about a lot of those things. And if you ask most people how well we've done addressing those issues, if a picture is worth 1,000 words, it's probably the best picture. So I'm going to turn the tables here, and you don't feel obligated to have to answer, but I'm going to ask your opinion. And I'm asking the question, what is healthcare? And when I say healthcare, I'm talking about health insurance, access to healthcare, doctor. What is healthcare? Is healthcare a basic right that you should have as an American? Is it a product that simply is like any other product that should be sold? Or is it a combination of the two? So again, don't feel obligated to answer if you're not sure. How many of you feel healthcare is a product? How many of you feel healthcare is a right? How many feel it's a combination of the two? Okay, interesting. Everybody recognize the dapper gentleman in the photo? Ronald Reagan, one of our most respected former presidents, and this picture was taken in 1963. Ronald Reagan at that point was hired by the American Medical Association in opposition to new legislation that was introduced, and that legislation, of course, was Medicare. So our controversies about healthcare and Medicare are nothing new. And some of the arguments back and forth are old, familiar arguments going back decades. And the only observation that I'll make is, as someone who's been on Medicare now for 7 years, I can't imagine what the landscape would be like for those of us over 65 if Medicare had not been passed back then. I'm going to tell you something that you may not know. How many of you are aware of the fact that we do have universal health care in this country? It's called the emergency room. Congress in the 90s, I can't remember if it was 94, passed federal legislation that mandated that hospitals have to admit, treat, and stabilize anybody that walks in the door. And it is an access system for everyone, but it's the worst. If you were going to design a healthcare system, it would be the worst possible system you could design. It is incredibly expensive. It doesn't provide any continuous care. And people who rely on the emergency room often will opt not to go for care, but do what we think of as tough it out. And I don't want to emotionalize this, but I want to put a human face on this because this is happening in all of our communities. I was telling Pat, I was telling Renee, I guess, we have a furniture showroom in High Point at the High Point Furniture Market. And we hire part-time people in April and May. And this young man was one of the contract people that comes into work. Great kid, 31 years old. And after market, he contracted pneumonia. He didn't have insurance. So of course, he tried to tough it out. And despite the urgings of his parents, his girlfriend, he stayed home, finally taken to the hospital. It was too late and he died. So the problem I'm talking about is a problem that sometimes has lethal consequences, and it affects people in our community. So I want to stop there, and again, I'm going to have a couple of times where I will break and let you guys make comments, questions. Does anybody have comment, question?
I just noticed you said it was interesting when you kind of took account of how we would look at healthcare. Did that surprise you?
No, it actually was pretty close to what I find when I talk to, I speak to a lot of groups, and it's very, very similar to what I find when I talk to groups. A lot of people are torn over exactly what healthcare is. Is it a right? Is it a product? Is it a combination of both? Both. Most people fall right in that category and say it's a combination of both. And the problem is, if it's a combination of both, how do you accommodate that? You know, how do you deal with it? So, go ahead.
What is the, digging down, what is the number one reason why people won't approach an emergency?
Well, they won't go because of the bill.
So there, it's the money issue.
It's the
The
bill.
unknown,
It's simply can't afford. They know they're gonna get socked with the highest possible bill and they can't afford to pay. And many of them don't have a relationship, many of the uninsured don't have a relationship with the primary care doctor.
I know it's an education thing, but I do know that there are public hospitals, for instance, UNC. There are different levels of emergency rooms, like some that you get in, they're gonna treat you and they may never bill you. I don't know what all the ins and outs are.
It varies, it does vary.
You know, so there's a lot of differences. So maybe it's more of an educational thing.
Well, if you're afraid of a $10,000 bill and you're making $18,000 a year, yeah, it's a tough one. Yeah. I'm gonna circulate here. Okay.
So there are other options, and this group is familiar with Alliance Medical Ministry, and it's in Raleigh. It's for the working poor. The charge you get, and anybody can show up there. The charge you get is what you pay per hour at your job. You show a check for that, and pay that. Whatever your problem is, it's taken care of. So there are other options. It's not like the only option is wake bed. There are other options. Look out for people who don't have insurance and are working.
It sounds like, and tell me if I'm wrong, it sounds like it's mainly preventive and maintenance. If you have a ruptured appendix or heart issue,
You're wrong. You show up there. Now, they have an allowance that they can spend on certain conditions on it. It's the funding for this is provided by it's donations, large people that contribute to this Alliance Medical Ministry. And so there are other options available. It's not like there's nothing, but it is a matter of education. But anybody can show up. If you need your appendix out, it'll be done, and you're not going to get a huge bill for it.
well, that's an unusual situation.
It is. That's why it was created in 2003, and it's seen like 400 or 500,000 people that are in this situation.
So I work in education and I help hire people. And one of the things I have is TB tests and shots and things like that. And we have young people coming out of college, and if they're first gen and they don't have, say, family support. Once they leave college and they're waiting to get their jobs, they don't have health care. And so it's difficult for them to find a way to pay for the health tests they have to have while they're waiting to get their jobs. Yeah. TB test costs $59.
Yeah, I wanted to just clarify in my own mind whether healthcare in this country is right or not. And it is for certain populations, military, for example, and a number of other special groups. But as a total nation, healthcare is still not a right. It is in many nations. It is not right. So what Charlie is talking about, many of the examples here is that's supposed to be all sorts of stopgap measures, government funding, private funding. I this together as a system is just something we have to keep. The other point I want to make is mentions of healthcare system. COVID-19 exposed tremendous with, at least with the hospital system, and its ability to manage surgery. And I think surgeons are also assuming to be something like a terrorist attack, as opposed to something wrong as this pandemic. But you may not agree with me. I do not believe that healthcare is right in the United States. I do believe it should.
Yeah, I think you're right.
Okay.
I have an observation, having served in higher education 40 years. We put it into the government system that you could borrow money. And what happened was we kept increasing the tuitions. Now people graduated from college and they're having extreme problems. Now, to switch over to the health insurance, when I was a child, there was no health insurance coverage together. And I can remember my father saying, if you put health insurance and give it to everyone, then everybody would use it. And you won't be able to afford the hospital bills. And you won't be able to help your doctor. So that is what's happening. I can go to the doctor for $3. Their shot of penicillin is $2. So you walk out the doctor's office for $5. You walk in there and get the same thing you did. And because of insurance, they're costing $200. I'm just saying, anytime anything is free, we use this as a heck of a. Well, the only thing I'm is even have insurance, it's hardly free. Most of the Americans that have health insurance now are somewhat underinsured. The average deductible is $2,500. So right off the bat, you may make a decision, I'm not gonna get that service, I'm not gonna do that because of the cost. And that cost has been going up. I'll get into cost of it. That cost has been going up faster than everything, including college, which is in second place as far as inflation. John, go ahead and hit it so we can move on. The contortionist here. Well, let's talk about costs. You mentioned it. John, hit the next slide. And one more time. Take a look at those numbers. I think the one that probably jumps out at you most is a 60-year-old. I'm not sure you can see that, but a 60-year-old with a $2,500 deductible. If they don't get assistance, this is buying an individual plan. A group plan is very, very similar to this. It's a total annual cost of $17,000 a year for a $2,500 deductible. So if you're making $50,000, that's a third of your income. How many people can afford that? All right, and let's talk about costs worldwide. We just looked at some numbers in the United States. This is a bar graph, and again, I know some of you in the back may have difficulty seeing it. The blue represents the United States, and it shows a per capita cost of over $10,000 a year. And then you have a list of other countries, other advanced countries, Germany, Australia, France, Japan, and that cost is about half of what the United States is paying. And I will tell you, I don't mind paying more for a really good meal. I go out to a good restaurant, my wife and I would pay more for a good meal, we'll never complain. And the United States, in my opinion, has the best trained doctors, nurses, and in some areas, the best facilities for some treatment in the world. But overall, we don't do a particularly good job of taking care of the whole population. Life expectancy, and it varies depending on which poll you go to, we're somewhere between 20th and 30th in the world. Infant mortality, we're somewhere between 30th and 40th in the world. So we're paying an awful lot, and our whole overall results are simply not great. And there are other reasons for that. It's not simply what our healthcare system does. There are other reasons, but our healthcare system is a huge part of that. One other thing, I want to point this out. To try to make it very complicated subject, very simple. One of the inefficiencies in the system is this. If you have Medicare, let's assume you have Medicare, and you have a ruptured appendix, your doctor is going to get $1 from Medicare, and your hospital is going to get $1 from Medicare. If you have Medicaid, your doctor would get 60 cents, and the hospital would get 60 cents. But if you have Blue Cross, Aetna, United Healthcare, the payments are all over the board. Your doctor could get $2.20, the hospital could get $2.20, or $2.40, or $2.50, or $2.60. it is an incredibly inefficient system to reimburse people for costs. And it's one of the reasons you go into a doctor's practice, and you have 4 or 5 doctors, but you have 15 people dealing with billing and coding, because you've got so many complicated systems of reimbursement. And I'm a huge advocate of free enterprise. I run an insurance agency, I was an insurance agent, I'm a huge advocate of free enterprise. But if you can't compare costs, and if you do compare it, it doesn't make any difference, that system doesn't work very well. So let me stop there and ask comments, questions.
I'll comment that a lot of the responsibility, I'm a physician, and I'm 80. Thank God. It's phenomenal. Now, the population and the customers they deal with is you. And the American culture wants it and wants it now. All you have to do is drive down any thoroughfare in the triangle, and you want to see Bojangles, Wendy's, McDonald's, and that's what our culture wants and wants now. There are limits on what medical facilities can do. If the patient doesn't take care of it, we are. Life is a blessing from God. And if we don't understand that, we've got to take care of ourselves. And if we don't have some responsibility, just exactly as you heard over here, there's no amount of economy or money that can pay for it. When you abuse yourself and you have an incredible amount of illness, including when COVID hit, it just turned the spotlight on how bad of health we really are. The people that suffer the most, unfortunately, are the worst. So we're the first responsibility comes to each of us. And that's one of the solutions to this problem that we need to start listening to. It's told us all the time, it's not like we're ignorant. We aren't ignorant. We know this, but we don't act on it, and we won't pay for it. And we don't have enough money to pay for it. It's like socialism. We can't afford it because it costs you money. Somebody else's money. We can't afford socialism.
Couple of quick. We're paying twice as much now as other countries are paying. We're paying twice as much. And when it comes to responsibility, you know, I guess one of the things I think back on, something like education. Education was a controversial, you know, public education was a huge controversial issue 100 years ago, 100 plus years ago on the states. Should we provide public education? We can't afford it. It's too expensive to educate every child. And we have a lot of children that are not responsible. And I can see a few of you smiling. So I'm thinking you're thinking back to your high school education experience and were you a responsible student? Because I probably wasn't. And if responsibility was the test for an education, I probably would have been expelled. So yes, there is a portion of it that is responsibility. But people that get cancer, heart disease, some are hugely responsible. And that's driving up the cost. And of course, that's one of the consequences. Yes.
Just before the break, you mentioned transparency presentation. Isn't there recent legislation around that should be impacting transparency on pricing?
Well, transparency, there is more of an effort. You go online, you compare some procedures, and you can look at some procedures and see what they can charge in a different facility for a knee replacement versus another facility. But let me ask you this question. How many of you shop when you buy a new car? How many of you shop prices? How many of you shop prices when you're ready for your hip replacement? I've had 2 of them. And you know why you don't shop? Because the system, you have a maximum out of pocket. Your maximum out of pocket might be $5,000, might be $8,000. If the hip replacement is $35,000 at one place and it's $38,000 at another, and your maximum out of pocket is $5,000, what incentive is there for you to shop? Are you going to shop coverage if you know the most you can pay is $5,000? So some of the dynamics, and this is the point I make, that work so well when we buy a house, buy a car, don't apply when you look at medical insurance. It's one of the reasons Medicare is so damn effective. You know, one of the things people tell me oftentimes is the government doesn't do anything as well as private business. And in most cases, I agree with that. But let me ask you this question. How many of you are on Medicare? Keep your hand up if you're happy with your Medicare.
Yes.
If I asked the same question about private insurance, I wouldn't have 100% saying you're pretty satisfied. So one of the things that the government does seem to do reasonably well, and there are a lot of things they don't, and I'll be first in line to say that, is Medicare. They do a good job. I love being on.
So what happens when it goes totally bankrupt?
Well, that means-
about that. You've got a system that's going to go bankrupt.
I don't think it needs, I don't think, knowing how many of us who are senior citizens vote, Congress is not going to let that go back. They're not going to let it happen. It's just simply a political non-event.
No, they may just slide it to 75.
I don't think there's that either. All those things, it's not a policy in the world that oppose that. All right, let me realize let's talk about possible solutions. Okay, so we're going to start with conservative, and then we're going to move through progressive. The first, and I'm grouping this very wrong. This is, if you are a true conservative, your belief is the best way to approach this problem with health is to let free enterprise do its thing. And let free enterprise competition, remove band-aids, and that will make the system better. Well, I started selling health insurance in 1985. You know what health insurance cost in 1985 per month? Everyone take a guess. $60, $70 a month for a $100 deductible. Now today, the average premium is $600 a month. And what you get for that is a $2,500 deductible. So I guess my biggest fear, and I'm an advocate for free enterprise. I don't want anybody to believe otherwise. But our system has not worked well with competition because of the fact that all those rules, those dynamics that make free enterprise work so well in other sectors don't work in medical insurance. So my only observation there, Don, I'll take what you say there, that's fine. My only observation there is that if we keep doing what we're doing, I think everybody that has private insurance is going to end up paying more and getting less. That's my observation. All right, second step, and again, I'm grouping these things together really wrong, is to introduce an option to compete with private insurance. And that option would be a Medicare option that people can pay into and buy into. And compete with United Healthcare, Aetna, and safety. I think that would help with cost. If you remember my earlier slide about Medicare paying $1 and private insurance paying $250 or $240 for the same procedure. But it doesn't address any of the huge problems we have. And some of you mentioned prescription drugs. Well, when you turn this TV on at 6 o'clock at night, at 8 o'clock at night, what are they running for advertisements? They're running a picture of a lot of grandfathers water skiing with the grandchildren after they've taken the latest drug, or a young woman jumping out on the stage singing with her folk song after folk group after she's taken the latest prescription. And they read off a bunch of side effects that include the loss of every single bottle and that is driving it. There's no one there to say no. You know what the test is now to introduce a new drug? It's called non-inferiority. That means you can bring a new drug on the market as long as it's no worse than the current drug. So you bring a new drug on the market, it's no better, no worse than the other drug, and you advertise the hell out of it and charge 4 times more than what selling for the old generic. So that's part of the system we have not been able to control. So a public option, I think, would help some with cost, but it doesn't address how many people we have running around uninsured. It doesn't address the rising cost of drugs. All right, John, let's go on to number 3. All right, so number 3 is to introduce something like a Medicare for All program. And I'll start by saying there are huge questions, and I have, about cost, about access, about waiting time. And those questions would have to be answered. But the system we have now, we're paying twice what other countries are paying for. And we're not getting terribly good results. This would ensure everybody. You know, we are the only advanced country in the world that does not provide at least a basic level of health care for all its citizens. We've addressed a lot of other problems. Who should vote? Do you have access to an attorney if you're charged with a crime? But we have not addressed the problem with health care. And I'll close and I'll open up for questions. I do think we're the greatest country in the world, but this is an issue we need to address. And David, how much time do we have? Okay.
That concludes questions.
Yeah. Okay, I'm going to stop here and try to do questions and just respond. So we're here.
If our medical care is so expensive and it's not as good as it where, it's probably a simplistic answer, where's the money going? Who's getting the money?
Well, pharmaceutical companies, for one, we probably, and this is a tricky one, we are kind of reverse of what other countries do. Other countries reimburse primary care doctors better than we. They don't reimburse specialists nearly as well. So there's a huge difference in the payout. And the efficiencies in the system, you know, Medicare spends about 3 or 4% on administrative costs. There's no profit. There's no advertising. They don't, in private insurance has somewhere between 15 and 20% over. So that's part of it.
Yeah, I think the other part of it is a lot of money spent in life care. So I'm sure it's that last 3 months of my life, you spend a tremendous amount of money to get the next one. That other countries do not. I don't think it is.
Well, what we should be doing, and again, is letting people know what their options are and saying, you know, you can say in the hospital, you can fill you with drugs, or you have an option to go to the hospital or go into care that is less expensive. I just think we don't do a good enough job sometimes in educating patients about what do you want. Here's your realistic expectations. What do you want? Do you want to stay in the hospital and get pumped out with drugs and fight this thing hopelessly? Or do you want to go home and be in your own house?
Yeah, speaking of healthcare, you know, I've been going on a proven experience. But when I turned 65, the biggest, well, I say, choosing a healthcare, what Medicare was turned 65, why does it have to be so complicated? And I think about the amount of mail that I have from everything I don't get out of the world. That had to be high cost.
It is, well, it's a crazy system and it is complicated. Yes. And
One more question. Or comment.
I have a comment that really goes back to the beginning of this call, is that in North Carolina, we've got 100 counties, there are at least 50 counties without an entity. So access is a much bigger issue than what we've talked about here today. We've got tremendous access here in Wake County. You go to Hope County, Northampton County, there's not a doctor within 50 miles. And that's a huge access issue for us. And it's just, it's a fact.
okay, I think I probably need to stop here.
Yes. I'm your spouse.
I want to thank you, brother. Thank you for your patience. I know what I'm talking about to you the wrong way. I'll tell you what I think, what my experience has been. And I've enjoyed it. It's been so nice to be face to face, even people that talk.
I think he should have a bulletproof vest underneath that suit. It's amazing the guts to take that non-controversial topic, right? But the other two, I think John, for the very first time, was magnificent over there. Let me show you what this club is like. We invite somebody to come in here and talk about. We invite somebody to come in here and talk about health insurance. And what do? Jerry gives us this pie that's big. 9 million calories in it. But for all of that, we would like to give you a gift for taking all those things into consideration to do for us. And these cards are by our own Jerry Miller. Dad is 90 years old, celebrating his birthday. But this for you. Thank you. Well done.
Thank you, Jim, and thank you, Rob. Somebody said 3 hours. I'm not sure that's enough. We're going to be having this debate until John is ready to collect Medicare, I suspect. But I'm thrilled that we're able to have a frank discussion from different perspectives and be able to share it in the group. So thank you for helping to facilitate that thought process. I do want to call out some special folks here today. We didn't have a chance to do this last time because of our chili dinner. So I didn't have an opportunity to congratulate Paul Carr. Paul is here somewhere. There he is. And Kristen Sutton, who on February 1st celebrated their 11th anniversary with Rotary. That apparently was a red letter day because Tim Naring is also inducted into the Cary Club. Tim's on leave right now, but he's 11 years and he had 5 before he joined us. But he's got you. Also on February 1st, Bruce Howell, 41 years ago. 4 years before that. Plus 4. I will amend DAC TV's records. February 12th, this week, Neil Lagarde will celebrate his 20th anniversary with Rotary. Another great reason for him to get involved with the charitable foundation. So thank you, Neil. We'll look forward to that next week again. Some character named Bob Griffin joined the club on February 13th, 4 years ago. The bankers in our group will appreciate it. In the lending business, they say if you don't make some loans that go bad, you're not lending enough money. I think this is a good example. Next week, our program, Dr. Howell has arranged to have Michael Walden, professor at NC State University, come and share his annual economic update with us. It's a sought-after ticket for many audiences across the triangle, so we look forward to seeing that. He'll join us in a meal of chicken piccata with rice pilaf and broccoli. We'll also we've had some great programs, some full agendas. Next week, I'll be excited to share a lot of work that the board has done to create a slate of officers for the club next year. So I want to introduce that. We'll vote on Neil and we'll place a slate of officers in front of the club for consideration about 30 days from now. I also need to tell you that the district training conference on February 19th, registration closes today. So at midnight tonight, we'll determine whether or not we're going to be in person at Greenwood Forest or online by Zoom. So if you're planning to go, express your preferences today. In 2 weeks, Pat Hudson's arranged to have Mary Beth O'Neill of the American Kennel Club come and join us and speak. So we'll definitely look forward to that. Yes, Jim?
We are having a memory cafe this afternoon. We have 5 couples signed up, which is 400% from last month.
If we keep that growth rate, we're gonna be doing pretty well by the end of the year. I definitely want to thank you, Rod and John, for coming again. Thank you so much for sharing your program. Kim, it's been great to have you. Great to have all of our Rotary guests join us today. Jerry, you have the floor to close the meeting.
I want to thank everybody for my 90th birthday party.
Let's do it again next year, Jerry.
Next time. We're gonna have some more 90s coming up. It's a club, I know.
You set the standard. Set the standard. All right, with that, can I ask Rossberry to please lead us out with the 4-way test?
All right, 4-way test of the things we think, say, or do. First,
Is it true?
second,
Is fair all concerned?
third,
Will it be good or or to the beneficial of all concerned?
Have a great week, everyone.
Good meeting.
Hey, thank you, man.
Well done.
Hey, that's gonna be great to have, you get to your 9.